Hi, I'm here at NAEMSP's 2024 annual meeting with Brandon Morshedi. He is the Comms Committee Chair here at NAEMSP, and my name is Chris Capuano. I'm the Communications Director of NAEMSP. Hi, Brandon. How's it going?
Hey, Chris. Thanks for having me.
Yeah, absolutely. So we just wrapped up some of the first plenary sessions of the first main day here at the conference. And tell me, how did those sessions go?
And that keynote was awesome. It's great to hear the roots of our subspecialty, our humble beginnings. I think we'll never truly know the sacrifice that group made to pave the way for something that we probably take for granted right now, to be able to go out and take care of our patients.
Yep. So yesterday you were one of the instructors at the cadaver lab.
Mm-hmm.
Talk to me a little bit about the procedures that you go through with the participants, and the value that they get from that lab.
So I was honored to be asked to help teach this year. It's been going for several years, led by Dr. Kieperman and a great group of instructors. We had a mix of physicians and EMS professionals, all the way from 20 plus years of experience down to, I just got into this a few months ago. We started out with some basic, followed by advanced airway management. We got to do a lot of field amputations, all the way up to some advanced thoracotomies, clamshells. We dissected out some of the lower abdominal anatomy, just teaching a lot of the kind of nuances, the pearls, the pitfalls of doing critical care procedures out in the field. Such a fantastic experience for them to be able to come and get this at a conference like this.
Well, I was able to pop my head in there for a little bit, and it seems like everyone was getting a lot of value out of that. Tomorrow you're also presenting a session on the use of audio documentation in patient refusals.
Yeah.
So tell me a little bit about what attendees can expect from that session.
All right. Well, I won't give it all away. Gotta leave you wanting more. So we're, I think we don't realize how these refusals that we run on. If you look at the NAEMSP data, it's about 20% of the runs end up in a refusal. So it's one of the more common calls that we go on, but we don't really spend a lot of time on training on it or reducing the risk associated with those type of calls. So what we were doing starting in Dallas and now also doing in Little Rock, we're documenting those refusals with a standardized script and getting an audio recording. We've been able to make a lot of improvements in how we run those refusals, significantly reducing our system's risk to the patient, the medic, the agency. Everyone wins from this. So I'm pretty excited to be able to give that talk tomorrow afternoon with my partner in crime. My former co-fellow was Dr. Brian Miller, so we'll be giving that talk together tomorrow afternoon.
Well, I'm excited to hear more about it. And the last thing I want to ask you about, I mentioned a few minutes ago that you are NAEMSP's Communications Committee Chair.
Mm-hmm.
So I'd like to hear a little bit about the work that you've done, over the past year, and maybe what you're looking forward to in the next year.
Yeah. I think we've really kind of expanded the footprint with involving a lot of the other committees around the association. Every committee is so busy. I think the committees and the state chapters are kind of the heart of the association. They're doing a lot of great work. They have agendas and initiatives. They're the boots on the ground of the association. So I think our role on the communications committee is to help them promote what they are doing so that everyone can see. Not everyone is part of every committee. So to be able to kind of crosswalk that work and the way that they're improving the industry, the association, we try to be that voice for them because they're humble and they're not going to be out there bragging on themselves. So that's my job, to brag on them.
All right. Well, I'm looking forward to more of the committee's work in the next year or so, talking about what all these incredible NAEMSP committees have going on. And thank you for taking the time to talk to me, Brandon.
Yeah, man. Appreciate it.
it.
Thanks.
All right.